Hello, I'm Lisa Martin from HORIBA Veterinary, and I'm delighted to welcome you to our latest CPD webinar. We'll shortly be hearing from Ian Wright, practicing veterinary surgeon and co-owner of the Mount Veterinary Practice in Fleetwood. Ian qualified from Glasgow University and has a master's degree in veterinary parasitology. He's head of SCAP UK and Ireland, head of guidelines for SCAP, and is also a board member for Veterinary CPD Journal. HORIBA are a well-established provider of veterinary diagnostic solutions across small animal, equine, farm, poultry and aquaculture industries. Our customers and associates include reference laboratories, veterinary referral centres and hospitals, and educational settings. Our product range includes handheld meters for testing single parameters, large benchtop clinical chemistry systems running up to 400 tests per hour, and the first fully integrated veterinary PCR benchtop system. Here's a short introduction about some of our products. Our LaquaTwin handheld meter range works in seconds, includes tests for metabolites and electrolytes, and can be used patient-side. Our unique ionised calcium meter aids in the detection of subclinical hypercalcemia in dairy cattle and uses just 1 drop of blood. This enables early intervention for better post-calving recovery, milk yield, and can even benefit future fertility. We offer a wet clinical chemistry system with our Pentra PC400. This gives reference laboratory quality results. The PC400 features integrated refrigeration capacity and 55 onboard assays for day-to-day testing and beyond, also including electrolytes, inflammatory markers and acute phase proteins. Today's webinar is linked to our Pocket Central PCR analyzer. This is a benchtop instrument which even the smallest veterinary laboratory can accommodate. All steps of the PCR process are fully automated and can be run by any trained member of the veterinary practice team. After inserting your sample cartridge and reagent into the pocket, it will present your positive or negative outcome just 85 minutes later. No waiting for a lab pickup or for your results to be sent through. The Pocket Central test range includes over 190 different assays for all walks of veterinary life: small animal, farm, equine, poultry and aquaculture. It can bring fast and easy PCR testing into your practice. Figures show that up to 10% of dogs and 4% of cats are being fed a fully or partially raw diet. Other pets such as ferrets, snakes and reptiles will also have a raw part to what they're being fed. By using the right approach to feeding, any risk of parasites and pathogens to these animals and the people around them can be minimised. If you have any questions about the webinar or about HORIBA products, we will have a question and answer session at the end of the presentation. You'll be able to pop your questions into the chat as seen on your screen, and we will answer as many of your queries as we can at the end of the webinar. Please note that the webinar today is about controlling the parasites associated with raw feeding and the role of testing, and neither Ian nor the HORIBA team are able to answer any nutritionally based questions. The contact details for Ian and for the HORIBA team will be available for you at the end of the webinar. If there are any other questions that spring to mind after the event, you're very welcome to get in touch and we will do our best to help. The webinar will be available to view after today's event, and you will be sent details of how to access the recording or to pass it on to anybody who hasn't been able to join us today. So now I'd like to hand over to Ian for his presentation on controlling parasites associated with raw feeding and the role of testing.
Okay, well, thank you very much for joining us and for that wonderful introduction. Yes, many of my clients would agree that Ian is unable to answer questions on pet nutrition. It's very much not my area. Eyes glaze over. But infectious disease, and particularly parasites, is a real concern around these diets as well. And it's some of those issues that we're going to be addressing this evening. A wonderful zoo of parasites that's available in your average raw meal. That's why I cook almost everything that I touch. Oh, there we go. Just a bit of a delay there. So there is, of course, a huge debate around raw diets and many aspects of them that polarises pet owners and polarises the veterinary profession as well. There are people who are very pro raw food and people who are very wary of it. From a parasite point of view, though, there are some things that are just undeniably true. And the first of those is that when people talk about raw diets, they are assuming best practice. They'll say, oh, raw diets are wonderful because they're going to be well balanced, because they're going to be treated properly, they're going to be processed, they're going to be adequately pre-frozen before delivery to the pets. But that isn't always, perhaps often, not what we see in practice. Often we see a lot of clients and pet owners, I wouldn't like to say that they're winging it, but perhaps a certain amount of improvisation, not always the education in place that they need. And, they're getting their information about raw feeding from all sorts of places. The trend is growing year on year. There's lots of information on social media. The vet isn't necessarily the first place that they will go for raw diet advice. So, we're coming in often when pets have started on raw diets. Often I found just in the past week, I've had raw diets crop up incidentally. So I haven't necessarily asked if they're on a raw diet. The owners volunteered the information. And, from there, we have to try and minimise risk. And I mean, from a parasite point of view, whichever side of the debate you're on, the best infectious disease advice is just not to feed raw. If we don't feed raw, that is going to eliminate a huge transmission route for the parasites that we're going to talk about. But, many vets want to promote raw, many clients want to feed raw. And if you're going to do that, we need to work with pet owners that are feeding raw, not demonize them, not sort of alienate them, but we do need to educate them regarding the risks that are there and try and give them best practice advice in regards to feeding and what we can do to minimize that parasite transmission risk. So raw feeding itself as well is a pretty broad church. I think when we talk about raw feeding, it's very difficult to compartmentalize it because there are three common forms of raw feeding. So, we have a truly processed raw diet. And this is something like, I'm going to take an example I'm familiar with, but other brands of processed raw diet are available. But if we take something like Nature's Menu as an example, it's highly processed, it's pre-frozen, and it comes in a bag in cubes that, sort of like familiar dog food that, I feeding a cooked diet would be familiar with, but just not cooked. But there are also clients that will want to feed a sort of home prepped, if you like, clear individual ingredients raw diet. And they might do that themselves. They might get a recipe off the internet, nip down to their butchers or their local farm or their local hunt, pick up some offal, some sides of meat, chuck it in a dish with some veg, maybe some fish products, whatever their recipe asks them to do. But they will do all of that themselves, either with, good nutritional information or sometimes not. Or they'll look for that sort of diet with clearly visible ingredients, but someone else will do the calculations for them. I had a client that was doing this just yesterday. So, go off to the sort of food producer, will have put this diet together for them, including the sort of raw meat, raw offal components, and then they will take it home, defrost it, and they will just pop it in the dish. So, 3 very different forms with various risks that accompany them. It is easy to forget, though, that there is a 4th type of raw diet feeding, and that is the one that we don't intend. So, cats will go out and hunt, but in terms of a lot of the parasites that we're going to talk about this evening, dogs will go out onto pasture, onto farm, and they'll find fallen carcasses. So they'll find predominantly sheep carcasses, and they will just dissect them. They're incredibly good at very quickly. Your sweet and innocent looking pooch, much loved cuddle family member will go out and dismember a sheep carcass, get to the lovely soft heart, intestines, liver, very quickly, and eat a wide range of product. So, that is something that we have to bear in mind. So, when we consider all of these different routes, there are actually, particularly globally, a mind-boggling number of parasites that could be transmitted through raw feeding. And even in the UK, there are some that we aren't going to cover, such as Toxocara, particularly through raw poultry, even Giardia through raw intestinal feeding and raw liver feeding. These are relatively low risk and relatively minor routes for those parasites. Here, the 5 parasites that we're really going to focus on, raw feeding can be a major route of transmission. And in terms of tapeworms, that is absolutely the case. So we have Taenia species tapeworms in dogs that are often transmitted through raw feeding. Echinococcus granulosus, hugely significant zoonosis transmitted to dogs, to domestic dogs, largely farm dogs, but raw feeding opens up the opportunity for dogs in all sorts of domestic environments to be exposed. And then 3 protozoa that we're going to focus on. So Neospora, only been known about for sort of 30, well, actually, I'm getting old, they're probably 40 now, 40 years. Sarcastis, and perhaps, famous, many clients will be aware of Toxoplasma Gondii in cats. So let's start with Echinococcus granulosus. So this is a tiny tapeworm that you may or may not be familiar with. Just a few millimeters long. It doesn't pass visible segments in the feces, but passes microscopic eggs. And if we accidentally consume those eggs, it can be a very significant zoonosis. So large fluid-filled cysts develop in our bodies, called hydatid cysts, that can do varying amounts of damage. So cysts can form in the brain, the lungs, the liver, can cause pathological fractures by growing adjacent bones. Really, really very nasty, potentially, wherever they grow. So a significant zoonosis that we want to avoid if at all possible. And this is where we need a life cycle, courtesy of the Welsh Government. Thank you very much. The Welsh Government loves big dogs that can kill sheep with their bare hands. And this is just one such example, carrying this tiny tapeworm, passing these microscopic eggs, and they, if they get onto pasture or get into feed stores, will be consumed by livestock, predominantly sheep. And will form these big cysts in their livers or lungs predominantly. But the thing is that they actually tolerate these cysts really well. So health consequences to the sheep and cattle is really very, very small. You do get some economic losses to the farmers, though, because any offal that's found with these cysts is going to be condemned. But most significantly of all, if that liver or lungs are consumed by dogs, then the the life cycle is completed. The worry is when we consume those eggs, and that may be from say fruit and veg, sort of from allotments, or sort of purchased from farms and then not washed before consumption, that are contaminated with dog feces and eggs as a result. Or it can be because we simply have an infected domestic dog in our household, and through shedding of eggs, that it can get passively moved around from the feces onto toys, onto hands, onto gardening equipment. It's very, very easy for those eggs to be transferred into our mouths. And then, potentially we're going to go on and develop hydatid disease. And one of the routes that dogs can be infected by this offal is through deliberate raw feeding of offal. And that can happen very commonly in hunt situations. So hunt packs are often fed raw offal straight off farms, and it happens very commonly on farm. A lot of hydatid disease, a lot of Echinococcus life cycle is completed on farm. But deliberate raw feeding, like I say, gives that opportunity for it to move off farm and more into domestic homes. So, really important parasite. But the next question is, where is it? Because it's endemic in the British Isles. Where is it in the British Isles? Well, it's been endemic in Wales forever. Certainly highly endemic. It was being closely tracked, highly endemic in the 1970s. And there's been an ongoing battle to try and get it under control in Wales, with varying degrees of success ever since. And the sort of epicenter of Echinococcus granulosus in Wales is Powys, and adjoining counties and the sort of English-Welsh border. It's not present in Ireland. It's never been found in Ireland. It's one of life's mysteries, but we think it's connected to the relative lack of density of sheep farming in Ireland. Plenty of sheep farming in Wales, plenty of sheep farming in the Western Isles of Scotland, where we also know it's endemic. Not so much in Ireland, so less opportunity for transmission on farm. There is strong circumstantial but building evidence that it's present in endemic foci in England. And I'll talk about that in a little bit, but also likely in mainland Scotland as well. And part of the difficulty in giving control advice is we just don't know exactly where the parasite is. And that is a difficulty. We absolutely need more surveillance, more sort of parasite distribution data, so we can, make a risk assessment on basis of geography as well as lifestyle. And at the moment in the UK, we're looking at about 8 cases a year. So, you sort of stop and think, wow, is that much of a worry? It's 8 cases a year. Well, disappointing if you're one of the 8 cases, but the main worry is that this has a huge incubation period time lag. So it takes about 7 to 10 years, sometimes longer. It can take up to 25 years for someone who's infected to then develop hydatid disease. And the worry is that trends like raw feeding, sort of increased contact on farm, the fact that we're not really tracking surveillance of this parasite means that if exposure risk is going up now, it would be at least 7 to 10 years before we saw those results in human disease incidents. So, let's say traditionally it's been considered to be a Welsh problem, and it's still a big problem in Wales. So, surveys through 2002, 2008 have shown still around 10% of dogs, especially on farm, positive for Echinococcus granulosus. And there's about a fifth of farms in mid Wales still positive, which is incredible given the control efforts that have continued. But this is all happening largely on farm. However, in 2015, a poor old engineer in Cumbria was infected, We don't quite know where he got his infection from. He hadn't been to Wales. He had no real connection with hunting or farming, and yet somehow, managed to get hydatidosis, suggesting that it was elsewhere from its traditional endemic foci. There have been studies doing copper antigen testing in the feces of dogs, mostly looking at hump packs, because that's another place where we know a lot of transmission takes place. So that was in Wales and England. And 2 packs, again, were found to be positive in the north of England. So, it is out there. We just don't know how much it's out there. And on the other side, looking at the intermediate hosts, there's abattoir slaughter data, sort of trace back studies that have shown, it's present in abattoirs from the sort of raw feeding point of view, right across the UK, well, with the exception of Northern Ireland, but right across Scotland, Wales, England. Not all of these abattoir cases can be traced back to endemic areas or known endemic areas, suggesting that it is present in other parts of the country. We just don't know where at the moment. And there is plenty of it. So, lots of livers being condemned across the UK because of hydatid cysts. So, something that we need to be very aware of. In a similar vein, Taenia, large Taenia parasites, so Taenia hydatidina, Taenia ovis, big tapeworms in dogs, are transmitted in a very similar way. So dogs get the tapeworms by eating cysts in the muscles of sheep for Taenia ovis and in the livers of sheep for Taenia hydatidina. And again, the sheep tolerate these cysts incredibly well. They develop a strong immunity, they carry relatively low numbers of cysts, but even so, this leads to considerable economic loss for farmers. So there's no health risk really to the dogs unless they get huge burdens. There's no zoonotic risk, but it does cause farmers' livelihoods sometimes because the amount of livers or the amount of sort of sheep carcasses that are condemned. And this is particularly damaging in small village communities, small farms, or islands like the Isle of Wight in this example, where in some cases you have 25% of livers in a single group condemned. So it'd be nice, if we could help farmers out and sort of break transmission and sort of work with pet owners to do that. But there is just general owner revulsion as well as these tapeworm segments crawl out of bottoms. And that is really the main driving factor that brings clients into the surgery and says, I would like you to sort this out, please. And we'll talk about sort of controlling sort of parasites in raw food as a whole once we've sort of gone through these parasites. But I think this is, the opportune time to talk about tapeworm treatments, because it is very important that at-risk dogs have preventative treatments, and that's to prevent zoonotic risk from Echinococcus, but also to try and reduce economic losses for farmers and to improve the human-animal bond by eliminating these segments. So, 4 times a year treatment in dogs, we know from studies, reduces zoonotic risk and reduces hydatidosis. So it's a good place to start, but it doesn't completely eliminate egg shedding. So it is absolutely essential that we treat high-risk dogs every 4 to 6 weeks to eliminate egg shedding. And so that is going to be all dogs with outdoor off-lead access to pasture in known endemic areas. You just can't take the risk of them being exposed. Anywhere else, if you've got dogs that we know have access to fallen carcasses, are shedding tapeworm segments, or they're on unprocessed, so unpre-frozen or inadequately pre-frozen raw diets, then they need to be on treatment every 4 to 6 weeks. If you've got dogs that are off pasture off lead and on pasture, and you just don't know what they're up to, and you don't know if you're an endemic area, that is a difficulty in terms of making a risk assessment. But I would say in that case, you still want to treat them at least 4 times a year. And this treatment wants to be with praziquantel because fenbendazole isn't as effective against Echinococcus. Praziquantel is a tapeworming nuclear weapon. It's going to kill every tapeworm in there, every single last one. But you know, the opposite is true. You know, if you've got a Chihuahua in a handbag in Greater London on a processed cooked diet, you know, it isn't going to need tapeworm treatment. So it is very much a case of making that lifestyle assessment. So where does tapeworm diagnosis come in? Well, you know, I've been saying that we don't know where the parasite is, where Echinococcus is across the UK. Team is pretty much everywhere. We don't know where Echinococcus is. Doing routine diagnostics, doing screening would help to demonstrate which dogs are being exposed and where Echinococcus is across the country. I mean, it would be nice, you know, if you could test instead of routinely treating, but the problem is that in terms of tinea, there isn't a test really with a high enough sensitivity to replace routine treatment for high-risk dogs. And in the case of Echinococcus, by the time you detected it, they would already be shedding eggs. There would already be a very significant zoonotic risk because these eggs are immediately infective. So there would already be a risk to owners. Where diagnosis is really useful is where you've got these off-lead dogs. You don't know if they're being exposed. The risk could be relatively low. And there, you know, doing routine testing for Echinococcus, you know, absolutely could be worthwhile, particularly, you know, if it is handy, if it's in-house, and if it's relatively inexpensive. And you're going to have some owners that are going to want to do that rather than go for the routine treatment. In terms of sort of other options for testing, fecal flotation for eggs is incredibly insensitive. So, you know, unfortunately, that's not really a sort of viable option. And copper antigen, to my knowledge, isn't currently commercially available. So PCR, which is highly sensitive, highly specific for Echinococcus species, but we've got to bear in mind that multilocularis isn't currently endemic in the UK, you know, is a very robust test. So let's move on to the protozoa, and indeed my favourite protozoa probably, Neospora caninum, because it's the new boy in town, and still a bit of an enduring parasite mystery, really, in that we've only really known about it for about 45 years. So, you know, was it there before, or is it a new parasite? You know, we just don't know. I mean, it was there for at least a little bit before, because Bjorkus almost discovered it in 1984. So he was staining up Toxoplasma cysts in historical samples and was looking at them in dogs, and they just weren't staining properly. And he was, oh, that's strange. And he probably thought he just had some weird form of Toxoplasma, and he sort of documented it and put it to one side. But it was the great protozoologist Dubé who classified it and worked out it was actually a new parasite all on its own, infecting dogs, and then subsequently discovered it was also infecting cattle. And this all took place in 1988. And it's got a bit of a complex life cycle, like Toxoplasma. It's very close cousin to Toxoplasma, but rather than it being a sort of cat, mouse, and sheep story, it's really a dog and cattle story. So you have definitive host, which is the dog, and then you have intermediate hosts, of which all sorts of species can act as intermediate hosts, but it's really cattle that are extremely good at transmitting it congenitally from one generation to the next. So good that for a long time we just weren't sure whether there was a definitive host, and all sorts of animals were tested, like eagles, badgers, all sorts of things were tested to see if they were the definitive host. But in the end, the dog was demonstrated to be. It sheds oocysts in its feces, microscopic oocysts in its feces that infect cattle. Very rarely, very sporadic, but just enough to cause the odd abortion storm or, mass sort of sudden increase in cattle prevalence. Dogs become infected by eating tissue cysts, largely in infected meat, and that is why raw feeding is so important. That and fallen livestock access is so important for Neospora to complete its life cycle. So why does it matter? Well, dogs sometimes do become sick by becoming infected themselves. So, they'll eat these tissue cysts, and most of the time it will have no effect on them. At some point in their lives, they'll shed some oocysts, and that will be it. But in some dogs, and often in very young dogs, sort of litters of puppies, you'll get a creeping hind limb paralysis, which can be fatal, can actually be quite difficult to treat. So there are sometimes consequences for dogs, but the big thing I think that Neospora is known for is the fact that it causes abortion in cattle in a similar way that Toxoplasma causes abortion in sheep. Cattle are much better at transferring Neospora congenitally, but even so, a small proportion of them will abort with, potential, high economic losses for farmers. And it can be a real problem when Neospora gets on farm. Most Neospora is brought onto farm by cattle, by infected cattle coming on and introducing the parasite, or just being present in those cattle because they've been introduced. But you can get what abortion storm, so some increase in abortion with tremendous economic loss because a dog's come along, pooed with oocysts into a grain store, that all those cattle feed upon, with some disastrous consequences as a result. In a similar way, Sarcastis causes similar economic problems for farmers. So this is a very closely related protozoa again, with a very similar life cycle. So you have an intermediate host, and then you have a definitive host that is infected by eating tissue cysts in meat or offal. There are a couple of different species of Sarcastis. So Sarcastis hominis infects us as the definitive host. So if we eat undercooked beef mostly, then we can start shedding oocysts. And then, if we have a poo in an inappropriate place, we could, if there's untreated raw sewage, we could potentially infect cattle. But it's relatively uncommon, but is one of the reasons that meat inspection is so important for Sarcastis, and why governments are so concerned. Having said that, if you've got an immune competent host, you might be a bit ill, but generally you'll get better. The main problem with Sarcastis is meat and offal condemnation, and that tends to be through Sarcastis cruzi. So in this case, dogs are the definitive host, shedding the oocysts, and it's cattle that are the intermediate host, having their meat and offal condemned because they've got cysts. And cattle are infected by the sporocysts on pasture. So they are either going to be from us having a needy defecation if we're camping in a field, or it's going to be from dogs getting onto pasture and defecating, or again getting into food stores and then causing abortion storms. People can also become ill by eating undercooked meat with S. cruzi, not because we shed the cysts, but just because we have a sort of bad reaction to them. But these events, are rare, and largely due to the fact that we cook our meat mostly, and that meat inspection will find a lot of these cysts. And this just to show you the cysts. So they're actually quite small, and some of them do get missed because meat inspectors are human beings, and there's a lot of hearts, livers, lungs, sort of carcasses to inspect. So this is sort of skeletal muscle on the left, hard on the right, and the cysts are very distinctive, but even so, they are missed. And this is part of the problem in terms of raw feeding in general. So we have to keep this in perspective, particularly in terms of the zoonotic risk. Sarcastis in the UK, across the whole of the UK, is rare. So, we're only looking at probably around 450 cases of sarcocystosis per year in carcasses and offal. So, relatively low condemnation rates. And across the board, very little impact on farmers. The problem again, and the reason that we need to educate owners and we need to be responsible, is that the losses through point source outbreaks, so through food stores being contaminated by dogs, can be massive and can put farmers out of business, particularly small farms and isolated groups. And then finally, we have in our sort of list of dodgy parasite suspects, we have the most famous of all, Toxoplasma Gondii. So this is another very closely related protozoa. All of these three are in the same group, the apicomplexan or sporozoan parasite group. The difference here is that Toxoplasma is transmitted by cats as the definitive host, and it is a significant zoonosis. So here we are more concerned about the zoonotic risk. So there have been links made between infection and, well, certainly in the immune suppressed, if we start there, I mean, it can be life-threatening in the immune suppressed, very, very severe disease. In the immune competent, you get sort of flu-like signs. Most people get better but continue to carry the parasite. One of the sort of main health worries that have developed in recent years is that there's been links between central nervous issues and psychological issues and Toxoplasma. So there's been correlations made with increased risk-taking, with bipolar syndromes, depression, suicidal tendencies. So these are only trends, but they are concerning given that still very, very large numbers of people worldwide are exposed to Toxoplasma infection, mostly through eating undercooked meat, it has to be said, rather than via cats. So again, we've got definitive and intermediate hosts, all sorts of rodents, birds, sheep, people can act as intermediate hosts. Only the cat acts as a definitive host. And again, it actually very rarely sheds oocysts. Most cats will only shed them once in their lifetime. And it's these oocysts that are a risk to people, as well as the cysts in meat, that if it's not cooked properly, can infect us as well. Cats, of course, mostly get their Toxoplasma through hunting, doing their own raw feeding by eating mice mostly, or other rodents, birds. But interestingly, there has been a link between raw diet feeding and an increased risk of shedding, which does follow. If you've got infected raw food that you're feeding to cats, it's not been adequately pre-frozen, then they are going to be more likely to shed the cysts over time, simply through the relative risk of them getting infected and the level of infection that they're going to be exposed to. And people get a lot of media exposure as well as actual exposure to Toxoplasma. So websites, newspapers lap up increased risks of suicide, bipolar syndrome, and clients are going to be especially worried about these things. But of course, the most common zoonotic complication that people are going to be concerned about is complications with pregnancy, if people are infected during pregnancy. And a lot of people are worried about the link with cats. But the fact is that, as long as people are sensible, as long as good hygiene measures are put in place, and, measures around raw diets, which we'll talk about, the risks from cats to people is actually very, very low. Most people do get infected through their diet, through their eating practices. So I'm just going to put these figures up because protozoa in raw food is not a theoretical risk. And I think, many people, particularly with meat inspection and the fact that the raw meat that is being, or raw offal that's being fed to pets, is going through the same meat inspection standards as it is for us. You think, well, are any cysts going to get through, really? Is this just a theoretical risk? But, there are studies being done around the world, and this one got a lot of attention in Holland, that found in sort of pre-frozen raw diets that they looked at, 11% contain Sarcastis cruzi and 6% contain Toxoplasma. So these are getting past meat inspection. You've got enough carcasses that are infected, enough offal that's infected. Even if a small percentage gets missed, through continual raw feeding, continual exposure, the risk is very, very real. And what this really demonstrates is the importance of adequate pre-freezing, which we'll talk about in a moment. But, absolutely not just a theoretical risk. Diagnosis of protozoa is hugely important. So, and not easy, it has to be said. So, microscopy has been one of the traditional go-tos, but oocysts, as we've just described, are actually rarely shed. And when they are shed, they're tiny. They're just a few micrometers long. Incredibly difficult to detect. So we've traditionally relied on serology, which is useful, but it only indicates exposure, and antibodies last for a very long time against these protozoa. So it can actually be very difficult to know whether it's previous exposure or active infection. And there's actually no correlation in cats between seropositivity for Toxoplasma and shedding of oocysts. So, both with clinical cases and with zoonotic risk, it doesn't necessarily tell us very much if we get a positive result. Again, in comparison, PCR is really, really useful. It's highly sensitive, it's highly specific, but it demonstrates active infection. Now, again, it doesn't necessarily demonstrate shedding, but it does demonstrate that you've got an infection on board at that time. And that is certainly very useful for clinical cases, but it does help us to gauge risk a little bit better as well. To my knowledge, and my sponsors may correct me, but I don't believe there's a commercially available test for Sarcastis, which does make that more difficult. But Neospora, Toxoplasma, you have got test options there. So why is it important? Why do we need to diagnose these protozoa? Well, I think the first thing to say is that there's no preventative treatment for these protozoa. So preventative strategies, which we'll talk about in a moment, have to be abstracts. We have to come in, but a parallel thinking, we have to sort of come in from a different angle than just using a preventative treatment. But in most of these protozoa, incidence and geographical spread across the UK has very little data. So, routine testing would help us to build that data up and would help us to assess risk, especially in pets that are being fed raw, and there's some debate about what the level of exposure is. It helps us to assess current risk for individuals. So, it may help to indicate a little bit whether you've got active infection and therefore whether there might be the possibility of shedding an exposure. It helps to raise awareness of increased risk. So for instance, if you have a cat that's positive for Toxocara by PCR, it doesn't mean it's definitely shedding. It doesn't mean it's going to shed, but it does mean we can emphasize the importance of extra precautions. So, really good hygiene, pregnant women in the household perhaps shouldn't be cleaning out the litter trays. Can put those just extra few precautions in place. It's really useful investigating source. So if you've got on farm, if you have a point source outbreak, immediately accusing looks go to the farm dog. Is it the farm dog? You can immediately test and see if the farm dog might be involved, and therefore, perhaps be isolated for periods of shedding. Or whether then you can try and see if maybe the infection has come from off farm, whether it might have come through feeding practices to that dog. Potentially life cycles can then be broken. And really importantly, it can be a means to convince clients that intervention is actually required. I mean, all of these things are theoretical risks until they're not. And I think, if you can do routine screening, say, if you've got a dog or a cat on a raw diet, and you can screen it for relevant protozoa, once a year even, then even if, clients are skeptical, they're not really prepared to take other measures, if you can demonstrate then that a cat or a dog is positive, they are that much more likely to take the situation seriously. So what steps can we take to control these parasites in general? Well, of course, the best step would be to avoid raw meat and offal altogether. But as I say, sometimes there isn't the desire to do that. And with some dogs that are on farm or, running around, off lead, that can be very, very difficult to achieve. However, there's 4 linchpins that we would use to try and minimise raw diet parasite transmission risk. So we do routine tapeworm treatment in high-risk dogs, as we've previously discussed, and that is absolutely essential to help manage tapeworm risk, especially where fallen livestock exposure is involved. In the case of intermediate risk dogs, we could look at testing or we could look at treatment, depending on discussion with the client and the relative risk. In terms of other things that we can do, though, the big 2 things are to preventing pasture access to dogs off lead. So, anti-dog fouling in general is good. We want to do everything we can to prevent dogs defecating on pasture or getting into grain stores and defecating there, but also having access to these fallen livestock and eating them. And we want to adequately freeze raw diets before feeding, because that will kill off these parasitic life stages. So what we want to do is try and engage with invested parties. So whether those be pet owners or farmers or hunt pack owners, it's good to talk and it's good to educate. And if we're going to do that, we have to try and avoid the sort of them and us, the sort of blame culture type of mentality, particularly if when we first come in, we find practices are poor. That is good. I mean, that is an opportunity to improve the situation and big strides can be made. So, with pasture access, we can encourage clients, perhaps with waiting room posters, with social media posts, practice websites to keep their dogs on lead when they're around pasture, when they're around sort of areas that are being actively used by sheep and cattle. And, I think if made aware of the risks and the reasons that we're asking clients to do that, I think big strides can be made in a positive way. And of course, in practices, we can promote anti-dog fouling. as well. We can supply poo bags, you know, something that everybody can get behind, often in sort of novel ways. But we can engage with farms as well. We can look at seeing if there are ways that we could get carcasses off pasture quicker, can make sure that farmers are aware of the sort of relative risks and benefits of doing that. It's difficult if your carcass is hanging off a cliff in the Western Isles of Scotland. I think we have to appreciate there are situations where that's difficult. But it's still just good to talk to farmers about these issues. And equally so, both with hunts and farmers, it's good to talk about what they're feeding their dogs and whether they are just feeding them raw offal, raw meats straight off farm. So, you know, that sort of engagement can help to break the life cycle at source. And there are some great posters like this one that was produced by the National Farmers Union, Kennel Club. There are a few groups involved, but, you know, just really good, bright, informative, but also asking that question. It's a bit of a nudge. It's like, are you a responsible dog owner? Are you letting your dog run all over that field, eat random sheep, poo in grain bins? You know, it's sort of, you know, it's putting the onus on the client, and you know, it was quite an effective campaign. I think you can still obtain these if you fancy decorating. Now people are back in practice, a little bit of your practice wall. Pre-freezing is the key to power, really, if you're going to feed raw diets in terms of sort of parasite transmission. I mean, as we discussed, some cysts are inevitably going to be missed at meat inspection. And that means that either cooking the food or really freezing it are the only sort of base defences against transmission if it's going to be fed. And, you know, for pre-freezing to be effective, food wants to be frozen at -18 degrees Celsius. For how long for does depend on the parasite. 10 days is going to kill pretty much everything. And for packaged processed diets, this of course has already been done. So this is an example from Nature's Menu. They supply this data and they are very proud that they have given their food a good freezing, and this long list of parasites as a result would all be stony dead. So in summary, you know, raw diets undeniably, whichever side of the fence you're on, pose a significant parasitic disease risk, whether that be in terms of economic impact, whether that be in terms to the individual cat or dog, or whether it be zoonotic. And it's one that we absolutely need to take seriously, and one that I think has taken a serious backseat to the bacterial risk, which is often discussed. Of course, avoiding raw feeding is the best way to mitigate that risk, but if not, you know, pre-freezing and tapeworm treatment is absolutely crucial if raw feeding is taking place. But, you know, for the protozoa especially, diagnostic testing is hugely important to assess if exposure is occurring, and it's a great way to engage clients and say, look, you know, here are the positive results. You're feeding raw, you know, let's see what we can do about this. And I would absolutely, as I do for a number of parasites, promote routine screening, specifically though in this case for cats and dogs that are on raw diets. I think annual screening, you know, if you can do that in-house, if you can do that relatively economically, it's a really good way to keep track of, you know, what protozoa these cats and dogs are being exposed to. So thank you very much. Thanks for listening. I think I've left a little bit of time for questions. So if I can hand back to our hosts, we'll see if we've got any.
So thank you so much, Ian, for that. Very informative, very useful again. I think having somebody who's so passionate about parasites and is also working every day in practice is incredibly useful for us, and we're very pleased to be working with you again. You've shown us some great graphics there this evening for tea time.
Yeah, lasting images, definitely.
I hope there weren't too many people put off their dinner, but I think if you're working in the profession, then you're probably not
You're
too
probably
fussed about
past
seeing
caring at this point, yeah. Tucking into your rare beef, you know, happy as Larry.
Exactly. Oh, there we are. My camera's on now. It wasn't working. So thanks again for that. As Ian's mentioned, we have seen an increase in owners wanting to feed either a fully or a partially raw diet. And the aim of our webinar this evening was to help make informed choices about those decisions that they're going to make. The webinar has been linked to the HORIBA Pocket Central, which you'll be able to see on the screen now. And we can test for a number of the parasites seen in the presentation this evening. And to answer the point that Ian made, yes, he was absolutely right in that we can test for Toxoplasma, we can test for Neospora, but Sarcastis isn't available at the moment. But we do have some of the bacterial tests available as well. So I know that we've had some questions coming in over the chat whilst Ian's been talking. We have got until 9 o'clock until it's time to switch off. So if there's anything else that you would like to know, please pop it in the question section of the chat there, and we'll get to as many of those as we possibly can.
Any views on raw as well would be interesting. I know, you know, it's a very controversial, very controversial area. So you know, I'm open,
I couldn't agree more.
Open suggestions and comments.
As you well know, Ian, it's something that we talked about before we came to producing this webinar, and people can either be very strongly on one side or another, but also there can be people who feel, you know, I feel very strongly that I want to feed a pre-prepared kibble type diet, but then if you have a dog that's anything like my own, doesn't matter what you want to feed him, he'll go and do his own thing. You know, if he's off the lead. I don't live in a rural area, but he still finds some pretty horrific things to ingest when he's put his mind to it. So even those of us with the best of intentions about keeping our dog's diet under control, and our cats too, obviously, are out much more than our dogs are. So I think
I do think it's very much like the imported dog debate. I think it's still good to engage. You know, I think that, you know, nothing's achieved by, becoming sort of polarized and, you're becoming entrenched in your views. I think that, you know, if raw feeding is taking place, then it's a case of doing what we can to ensure that best practice is taking place.
No, absolutely, and I think as well, taking that view in that, none of us can be so blinkered that we think we know everything that our cats or our dogs ingest all of the time. So your very valuable preventative advice about products available on the market is incredibly useful. So I'm going to go on to some of the questions that we've had in, because they're dashing in now. I want to make sure we cover as many as possible.
Yeah, no,
so let's crack on. So they started coming in really early, and some of them I think may have been covered as part of your presentation, but we'll do our best to answer everything. So Anne has asked if an owner is insistent on raw feeding, of the ones that are commercially available, are there any that you would consider to be the best?
Right. Okay. So I only smile because, like I say, you know, if they're asking me on a nutritional basis, you know, my eyes are already glazed over. I'll be like, but I mean, you know, the most important thing from a disease transmission point of view, pre-freezing is the most important thing. And, you know, the best way to ensure, well, I mean, I'm going to say it again, the best way to ensure that parasite transmission doesn't take place is if it's cooked. But pre-freezing to the level that's something like nature's menu, that's, you know, been processed, pre-frozen for 10 days, you know, that is going to ensure that almost or probably all parasitic life stages are dead. So, you know, that level of freezing from a parasite point of view, I can't comment on the bacterial side, but on the parasite point of view, is going to be as good as cooking, really. What worries me, and, you know, I've seen a lot of this just this week, it seems to be a growing trend, is that people will come in and they'll say, oh, I've got it from Joe down the road, he formulates his own diets, or, you know, I got it from, you know, Rora Dog, which, you know, is online, and they just put the ingredients together and, you know, they just post them out frozen. And yet there's no real indication that I can see how long these products have been frozen for. So is it for an adequate period? You know, is it not for an adequate period? And that's what concerns me, really. And if you don't know adequate freezing has taken place, you know, you can tapeworm treat. You can sort of head that one off at the pass by using an appropriate tapeworm treatment. But there is, you know, no treatment or no preventative treatment for the protozoa that we've been talking about. Yeah. So I think in that situation, you know, if they don't know the freezing situation and they're insistent they're going to feed these types of diet anyway, that's where your testing, your good hand hygiene, you're keeping your dog on the lead, you know, are all, you know, such important steps, you know, to try and minimize the risks.
Yeah. Okay, thank you. And I hope that's answered your question. A couple of comments from early on as well, which I think we've probably covered as part of the talk. So both kibble and raw-fed dogs can eat sheep carcasses, which is the point that we've just made. We cannot blame infection on raw dogs, raw-fed dogs. Raw dogs? Apologies. So yeah, we've agreed with that point completely. And
yes, and again, you see the word blame has already been used. There is no blame. You know, they're just two separate transmission routes, and we want to take steps to make sure that the parasites aren't being transmitted by either route. You know, but they're absolutely not mutually exclusive. You know, I know, you know, dogs that are on raw diets that are also off in the fields getting their hands on all sorts. And of course, most cats, I suspect, that are on a raw diet are supplementing that, you know, elsewhere.
Yeah.
So, you know, it's not a simple, you know, if you get a positive result, you can't point at the diet and go, oh, look, that's definitely come from that diet. I mean, we're not talking about bacteria tonight because I'm not a bacteriologist, but I had a similar situation with a Campylobacter positive dog the other day, and the owner was, you know, beating themselves up, going, feed raw, and, you know, as the Campylobacter come from the raw diet, you know, without testing the food, who knows? I mean, I've seen, you know, we've all seen plenty of dogs on cooked diets that get Campylobacter as well. So I think you have to be careful not to jump to conclusions. But, you know, the idea of screening for these parasites, you know, if dogs and cats are on raw diets, is then to question whether the raw diet might be the source. You know, ignorance isn't going to help, you know, the transmission situation.
No, absolutely, and I think that the point that you've made about keeping the lines of communication open, not you know, approaching this with a blame mindset, keeps everybody on the same page. You know, we've got to work with pet owners if they're choosing to feed raw, and just keep the pets and the people around them as safe as we can. Which goes to a point as well, as you touched on bacteria there, which we're not mentioning today, but along with all of the testing and of the parasite treatments they can use, obviously there's a really good place for basic good common sense and hygiene in the kitchen or wherever you're choosing to feed your dog as well. So we must acknowledge that too, that every part of the dog's diet and its preparation's got to be taken into account if there's an issue. So another comment was, I believe that freezing raw food removes all significant parasite risks. So we've talked about that, and Ian has touched on the times, or the minimum time certainly, that he would recommend from research. We talked a lot about data this evening. These aren't just Ian's opinions, you know, it's data, it's based on.
And again, I'd like to say I'm in no way sponsored by Nature's Menu, but they do have that parasite list, which is actually very, very useful and very responsible on their part. The only thing I would reiterate is, just because a client turns up and says that they get their meat frozen or their offal frozen does not mean it's been frozen, you know, cold enough or long enough to kill all the parasites. It's really important to get that information.
Yeah, okay. Thanks again for that, Ian. A comment from Georgina, Echinococcus granulosus is classified as a hazard group 3 pathogen in humans. Any human clinical specimens would require significant health and safety precautions when being processed. So that's an interesting point, Georgina. Thank you for pointing that out. Next question, are there any concerns currently about anthelmintic resistance, e.g. praziquantel? What's your feeling on that, Ian?
Mercifully, no. Which, I mean, I say that there has been a strong evidence for a case in Dipylidium, that's flea tapeworm, in the US. But otherwise not. And I mean, you know, don't get me wrong, it's a bit of a house of cards. We rely very heavily on praziquantel to keep us safe from Echinococcus multilocularis, which is granulosus's evil cousin on the continent. But no, fortunately not. And the reason for that is, well, there's many and varied, but partially it's because we have intermediate hosts that are sort of diluting out the selection pressure. But also, you know, there generally are large groups of dogs that are sort of tapewormed in very concentrated ways. So, you know, when resistance develops in horses or ruminants, you know, there's small groups, you know, on pasture that are targeted specifically. You know, arrested stages in their bodies are targeted. There's no wildlife reservoir. So, you know, selection pressure is very, very large. Where you've got tapeworms with intermediate hosts, that does help to dilute that selection pressure out. But, you know, these are zoonotic parasites. Now, I'm sure that some of the listeners will have heard me say this before, but again, just to reiterate, you don't limit resistance by not treating uninfected dogs. You only limit resistance by deliberately letting them shed eggs, which in this case would be, you know, zoonotic eggs. And you just can't make, you know, that justification, particularly in this case where the eggs would be immediately infective to owners. So it's not even a greater good, you know, they would be immediately putting owners at risk. So,
Sure.
you know, where, you know, we need to be vigilant for resistance, which again is where testing, routine testing is very important. You know, we need to pick it up if it's happening. We need to make sure that dosing is accurate, that people know how to give products. But the risk assessment is more to limit over-treatment in general. You know, so if there are any, say, environmental knock-on aspects, you know, if clients are worried about sort of, you know, putting drugs into their pets when it's not necessary, that's where a lifestyle assessment for tapeworms can, you know, is very, very, you know, it lends itself very well to that. You know, you can look at the lifestyle, you know, are they on unprocessed raw? You know, are they in high geographic risk areas?
Sure.
Do they hunt? Do they have access to fallen livestock? You can make that assessment and then decide whether they need the treatment. But resistance, anthelmintic resistance, is not what you're trying to avoid there, because you're trying to work out, you know, which dogs are likely to be infected and then treat them.
Okay. Thanks very much for that, Ian. And it's good to know that we've still got things in our armoury that are working nicely. We haven't got to worry about.
I mean, we do rely on it heavily, and like I say, I hope that pharma companies are secretly working on, you know, new tapeworm drugs, because we could do with at least one more, really, just in case there was a drug resistance outbreak.
Okay, thank you. I know we do have some questions that have come in around products as well. So for anybody that sent in a product question, I'm working my way down the list. We will get there. I'm mindful of the time as well. So I'm just scanning through the list of questions now. We've had a couple of queries about CPD certificates as well. So yes, if you would like a CPD certificate for this evening, please ensure that it's in the questions chat. We don't issue them as standard, but we're very happy to organise one for you for this evening. It'll be 1.5 hours of CPD. So if you'd like a named certificate, we can organise that for you. Please pop your name into the questions which we can access later, so we'll get those organised for you. Query, is it necessary to obtain CSF for a Neospora PCR for the pocket? No, it isn't, and we can discuss that with you. We can see who's raised that question, and we can discuss that with you later. Certainly for the pocket, for your external laboratory, they may request a CSF sample. You would have to see what their individual requirements are. Okay.
It would depend on the case as well. So, you know, if you've got neurological signs in a clinical case and you're positive by fecal for Neospora or by serology, it doesn't necessarily mean that Neospora is the cause of the sort of clinical sign. So in that case, you know, you might want to do a CSF tap. You know, there's a range of other tests that you might want to do. So, you know, it's going to vary from case to case what sample you want to use.
Okay, thanks for that tip, Ian. Okay, I'm just going through more questions now. So, are we able to say, Ian, what percentage of food poisoning in pets is due to parasites compared to bacteria?
Well, actually, parasites. So when we talk about food poisoning, generally we're talking about gastrointestinal signs, and the answer from parasites is almost zero. So the signs that you know, so well, first of all, we take the tapeworms. You know, amazingly well tolerated by their hosts. So, you know, in the case of Echinococcus, no clinical signs in dogs at all. Big tapeworms, to be fair, if you get a large burden, occasionally you'll get intestinal obstruction or you'll get loss of body condition because they're eating all the food. So, you know, in that situation, large burdens, I guess you might get GI signs. There are, you know, documented cases of Giardia being transmitted through raw feeding, and I wouldn't say that's a common occurrence compared with, you know, most ways Giardia is transmitted. So, you know, there is the odd GI case, but most GI cases from raw feeding, I would imagine, are going to come from food poisoning bugs in raw food. Having said that, I mean, there are, you know, neurological signs that Neospora, Toxoplasma can cause. So, you know, there are potential clinical consequences for cats and dogs, but it's mostly zoonotic risk and economic loss that we're managing.
Okay, thank you. Some more comments and questions. They're still coming in thick and fast, so thank you so much to everybody who's contributing. You're making my job quite challenging, but it's really pleasing to see the discussion that this evening's webinar has promoted. A great comment here around zoonotic bacteria and parasite risk, commenting that many raw feeders may migrate towards being anti-vet or anti-parasite treatment, which is a really valid point. So I saw something on a forum only earlier this week on social media about the use of feeding rabbits' ears for parasite control,
Yes.
generally speaking. So after I read through, I think the 123rd comment of 496, I didn't continue that reading any further. I had to go on and do other things. But I think Ian's point about keeping the lines of communication open and being straight down the line about this, you know, if people are going to choose to feed raw, keeping their pets and the people around them as safe as we possibly can. So let's have a look. We have a public footpath running through our sheep field. We have hydatid cysts in sheep carcasses. This is in southwest Scotland. Also, we are seeing a huge increase in Giardia cases in the last couple of years. Is this poor lockdown puppies, raw feeding, or might it be something else?
Well, so I mean, what you've just described there is the classic sort of epidemiological situation for hydatids. So, you know, large numbers of sheep, so potential for on-farm transmission. So, you know, I mean, there's essentially a number of things with the hydatid that could be happening. So, you know, it may be that the dogs walking on the path are infected and shedding onto the field. And then, having access to carcasses or being fed raw themselves. So that's possible. So it could be dog on the path to farm transmission, and then back to the dog versus raw feeding, or through fallen livestock transmission. It has to be said, and I don't know about this farm, I can't comment on individual cases, but a lot of hydatid, the whole life cycle is still being completed on farm. So,
Okay.
farm dog or hunt dogs to livestock, back to them through direct feeding. So sometimes this is where lack of blame is so important. So, sometimes the public are involved through, shall we say, lack of close monitoring of their dogs, and through raw feeding. But sometimes it's all farm, and I mean, I think the take-home message would be not to make assumptions. Because, as a vet, you're going to go and investigate this situation, and there are going to be fingers of blame being pointed. And even the suggestion that, the finger pointing person might be at a degree of fault themselves, it isn't going to go down very well. But, if you're going to get to the bottom of the outbreak, you've got to establish where the transmission is taking place and what's going on. But in general, putting up notices and signs in practices engaging with farms can only be helpful, really, as well as speaking to the farmers, saying, look, in practice, we're really asking people, we're really promoting that they would just keep their dogs on a lead, pick up their dog poo, is great cooperation. And those are the sorts of bridges that we want to be building. Rather than
with your farmers.
I can imagine. I don't have a lot of farmer up in Fleetwood. I don't have a lot of farmer meetings, but I can imagine if you've got an angry farmer, it could be quite intimidating. It would be tempting to join in and go, oh yeah, bloody raw feeding, off lead public. But it's really a case of just taking a step back and saying, look, I'm the objective person here. Let's try and work out where the infections come from.
Okay, thanks. That's very practical, good advice. Thanks, Ian. A comment come in from Libby. Thank you very much for this. It says the Pet Food Manufacturers Association have raw feeding members who have agreed best practice guidelines. So there's a suggestion that if looking for companies for a raw feeding recommendation, go to the PFMA, and they should be able to help you with that. So that wasn't something I was aware of. That's good advice. I'm just going through now, making sure we are covering everything. The person that's watching from Australia.
I can't comment on the Australian situation.
Yes, absolutely being recorded, and after the webinar we'll be sending out an email, so you'll be able to catch it right from the very beginning, or if there are any colleagues who would like to watch afterwards as well, then you'll be able to pass on a link. How is salmonella controlled in raw food? Can we touch on that, Ian, or is that something you're less happy talking about?
It's not that I'm not happy to answer the question. I just don't know, I'm afraid. Okay. Not my area, but sorry.
No, that's fine. That's fine. I'm sorry that we can't answer your question. I think that the
perhaps you need a part 2 with a bacteriologist. That's the.
I think, having seen how popular this has been this evening, I think that's a really good idea. If you know a good bacteriologist, then please point them in my direction, or if there's anybody in the audience who can help us with that, then we'd be very, very happy to run another webinar. Any tips on how to convince owners of the importance of this? What would your tips on a practical level be? The kind of the I don't want to use the word arguments, if you like, but
so that would be my tip, is don't argue. So it's always, I know it's not easy, but always be positive is the answer. So I mean, bearing in mind that, like I say, some vets, are pro-raw, which, is absolutely fine, but So it depends where you're starting from. I mean, my interest is in infectious disease, so my start tends to be, have you considered cooking it? But if not, then you say, well, okay, that's fine. So has it been adequately pre-frozen? And I mean, if it's something like, Nature's Menu or equivalent, then jobs are good. Or if it's going to be one off that, sort of website, you can go, you can have a look, you can ask the owners to check if it's been pre-frozen.
Okay.
The next step is to say, well, if it's not one of those, if you are picking up packets of fresh meat and offal, essentially, that's been pre-frozen, then the question is can you find out reliably if it's been adequately pre-frozen? And if you're in any doubt, that's when you engage and you say, well, that's, okay, that's good. Your dog likes it. I mean, the dogs that I've seen on these diets have been in fine body condition, no other health problems. But then you want to say, look, there is a risk here. And, you can briefly describe the risks that you've heard about tonight. And you can say, well, have you considered, if that's the case, perhaps testing? Even if it's just at the booster, we can do it relatively economically. Let's put some testing in place. Hand hygiene, is really important. If it's a cat and it's on a raw diet, testing for Toxoplasma, but also saying, have you sort of, are there pregnant women? Sort of, is hygiene good enough? What's happening with litter trays? You can go through all of these steps, but all the time in a sort of positive fashion. With any of these discussions, like the imported pets as well, the moment you become confrontational, you're done, really. They're going to go and they're going to carry on doing whatever they were doing before. So, positive step-by-step engagement is the way to go.
Thanks. I think that's really good advice. And I know sometimes it's easier said than done, but keeping patient and not being judgmental about it, whichever side of the fence you're on, is always a helpful approach.
Absolutely.
A treatment question here. So from Rachel, we use a lot of NexGard Spectra and recommend tapeworm treatment every 6 months for most cases. Should we be asking client if raw feeding, and if so, advised increased tapeworm frequency? And if so, how often would you suggest?
So yes, is the answer. Absolutely. So, use of tapeworm products is a risk assessment, and raw feeding is one of the major risks. So again, it depends on the type. So if it is definitely adequately pre-frozen, there's no real increase in risk. But if there's doubt about the freezing, I would recommend monthly. I think that, the risk of tapeworm transmission through unprocessed, not adequately pre-frozen raw food is high. So, monthly praziquantel is the way to go. And then you can sort of fit that into however you're going to fit it in, you can fit it into your parasite control program. Mm-hmm. But those are the only two questions when you're making your risk assessment, because I know time, especially at the moment, time is limited, but only two questions you need to ask about the food really is it raw? And if it's raw, is it a processed, is it in a bag? Has it been adequately pre-frozen? And if there's any doubt, if the client's like, I'm not sure, is that, as no, let's tapeworm monthly, and jobs are good.
Okay, that's great, Ian. Thanks for that. I'm just whizzing through the questions again now, see if there's anything else. There's a few that have come up that I know that we've answered as part of the talk as we've gone along. So if there are, we are drawing to a close now. So if there's anybody who wants to get in a question right at the end, anything we haven't covered yet, then please pop them in. Also on the screen there, you can see contact details for my colleague Paul Lima and I. So you're very welcome to get in touch. You can contact also through the HORIBA website and through social media links as well. So we are very happy to answer any questions that we haven't been able to cover this evening. I do believe that I've got everything. But if there's anything that I've missed or anything that does spring to mind after this evening's presentation, then you're really very welcome to get in touch with us. We'll be very happy to hear from you. lots of requests for CPD certificates, so if you can bear with us, we'll get all those done and sent out to you. A lot of comments thanking you for your brilliant presentation, Ian. I've really enjoyed it. And a lot of people have said that they feel very much more well equipped to speak to clients now about raw feeding. We've had a very balanced view and how to frame the questions and to propose solutions to clients as well in a really helpful way. So thanks very much for that.
My pleasure. My pleasure. Always happy to talk parasites. Always.
Yeah. So that's everything that we've got so far. So thank you so much to everybody for joining us this evening. It's been a really enjoyable Thursday night, especially to Nick as well, who's had a few happy birthdays in the comments.
Happy
birthday. So thanks to everyone. We do have some events coming up as well. It's really nice for us all to be back out and seeing people again in the flesh, not just on a screen. So you'll see on your screen now that HORIBA will be in person at Vets Cymru in Aberystwyth, which I know that Ian is speaking there as well.
Going to the heart of tapeworm country.
Absolutely. We'll be going as far west as you can go until it gets wet. So we'll be there. I think I'm not sure about if that. Oh no, that date is correct. Sorry, that's my error. We are also going to be at BSAVA, which isn't on there. We'll be at BVA Live and at the London Vet Show. So really nice to be seeing people there. Please come and see us on the stand. We'll have a pocket PCR analyzer there if you want to see it in the flesh. Then you can do, or if you'd like to know more about the pocket or any of our other products, you can have a look at the HORIBA website. Any other subjects that you would like us to cover, we're very, very happy to do that. We've had previous webinars on parasites in imported dogs, which Ian very kindly did for us last year, and also a real back to basics for haematology in practice from Ronnie Barron from Glasgow Vet School. So they're also available to view back if you'd like to. So again, thank you to everybody for joining us. It's been a pleasure to host our webinar this evening. And keep safe and enjoy the rest of your night. Thank you so much.
Thanks. Take care.
Bye.